my next guest is speaking at the conference later today. He is focusing on strategy, goals, and growth in the field. Here now is the CEO of Quest Diagnostics, Steve Rusckowski, joining me right now, and it is good to see you, Steve.
Good morning.
Thank you so much for joining us.
Thank you for having us.
Well, you've got some new products out. You're talking about growth at Quest. Tell us where the growth is first and what you'll be talking about later. But also, I want to really get your opinion on how the consumer and what the consumer wants is really driving your decision-making.
Well, a big opportunity we see in 19 is that we have new access with some relationships we have with healthcare insurance companies. And particularly, we got back in network with United Healthcare. And so in 19, we actually have 43 million new lives in this country that have access to Quest Diagnostics. And that affords us a big opportunity. That represents about a $4 billion opportunity. And if you look at our market share with healthcare insurance companies, it's probably about $1 billion opportunity for Quest.
Wow, that's great. So where does the growth come from then at Quest? Let's call it the next 3 years.
We serve about 50% of physicians, 50% of hospital systems. And so when a patient goes into the physician's office and they have United Healthcare as their insurance company, when they have that opportunity, the physician now could recommend Quest as the laboratory that they use.
That's a big deal. We know that the hospitals have been under tremendous pressure. There's been all this consolidation, mergers in the hospital business, hospital medical providers taking cues from consumers to improve the experience. You also have a deal with Walmart.
Yes, exactly.
I think that's really interesting.
Exactly. So there's two pieces of this. One is the hospital systems need our help as well, and we're working with those hospital executives on their lab strategy. And many consumers are now asking the questions about the wide variation in healthcare costs. And many consumers are paying for a larger portion of the healthcare costs. And if you look at our industry, there's wide variation in the differences between laboratory costing. And consumers are now becoming aware of that. And so now they have access to data that suggests that they should go to the best value provider. And Quest Diagnostics is one of the best value providers in our space.
So you've added consumer-oriented programs like telemedicine, urgent care centers, so that people can be in charge of their own health care. I mean, it's interesting to me that when people want information about their health care, they Google it. I mean, there's all this information. So they're feeling more, empowered to make decisions on their own, and you're trying to enable that.
So we're bringing digital technology to our space. So the experience today is completely different than it was 3 or 4 years ago. So with that digital experience with Quest Diagnostics is far different from what it was. Second, as you mentioned earlier, Maria, this relationship with Walmart. So we're going into better space, better physical space with a partner like Walmart, where we actually have some of our patient service centers in their stores. And then finally, we're bringing products where consumers now can order directly laboratory testing in 22 states without an order from their physician.
Let me ask you about the state of business today, because at the end of the year last year, you lowered guidance. You tried to get the market set for lower numbers in revenue and earnings. Why? And tell me what's ahead.
We came out in 2018 with a lot of expectation around growth. And frankly, we saw a lot of growth through acquisitions. We actually grew faster with acquisitions in 2018. So actually, we are consolidating the marketplace. But what we did see in the back half of the year particularly is some headwinds with some reimbursement changes with a couple of our test categories. And second, utilization in the back half of this year with the amount of healthcare that people were using in the back half were lower than expectation.
How do you change that? How do you get back on track?
Well, the access for healthcare insurance, what we started with United Healthcare, is a big opportunity for us. Second is continuing to make sure that brand of Quest Diagnostics is really second to none. And third is the opportunity around the consumer, where consumers can be asking their physician to use Quest.
You raised your dividend nonetheless, and basically you continue raising your dividend since 2011. For shareholders watching this out there, is there any sort of threat to the dividend given the fact that you are seeing these issues at the end of the year?
We are the market leader in a very unconsolidated marketplace. We continue to see big opportunities to continue to gain share. 19 is a year for us to continue to gain share. And when we do that, we're very profitable because our scale is really second to none.
All right. So when we're hearing about this potential economic slowdown, is that hitting you? Is that part of this or not?
Healthcare continues to grow. We continue to see mid-single-digit growth in overall healthcare. We're essential to healthcare. We're about 2% of healthcare costs. 70% of healthcare decision-making is based upon what we do. 1/3 of all patient encounters involve what we do. So we're critical, and our volume is actually going to go up next year.
Let me ask you about the new Medicare pricing for lab tests under the Protecting Access to Medicare Act of 2014. How do you navigate that?
So it's a big change for us, because actually how we get reimbursed for Medicare will go down. The cut was larger than we expected, and we actually think CMS got it wrong how they implemented the bill. We're working to change that. But what we have done is plan for the worst. And so we're actually looking at what we need to do to drive productivity, what we need to do to drive share. And by doing so, continuing our leadership position, consolidate the marketplace, it will benefit us and benefit the people we serve, our patients and those physicians that they go to.
According to Johns Hopkins, the United States spends more on health care than any other country. What do you see as the solution here to get costs down?
You know, if you look at the data, healthcare costs for sure, but if you look at social programs and you put the two together, we're not necessarily on top. And a lot of what healthcare does and what medicine does is actually around those social issues, those social determinants. And I think the opportunity we see is how do you really bend the cost curve? You know, healthcare costs is continuing to rise at 5%. We really haven't put a lot of energy in this country around transforming how healthcare really works. In my view is if you look at the population that really drives healthcare, it's 5% of the population, 50% of the cost. If we can get after that 50% of the population, we could definitely start to flatten out that cost curve.
All right, we will leave it there. Steve, it's great to have you on the program.
Thank you for having us.
We'll be watching the developments and your
Appreciate
growth plans for sure. Steve Rusckowski joining us, CEO of Quest Diagnostics.